Good afternoon. It's Mark Bryant. I'm the Public Information Officer for the Mobile County Health Department. Thank you for joining us again for our daily COVID-19 coronavirus update. Um, I know I've started off the last 2 days like this. Unfortunately, it's the third day in a row. We've had our fourth death here in Mobile County. It was a 64-year-old male who did have a history of underlying medical conditions. He presented to the hospital with known COVID-19 symptoms and was hospitalized. So that is the fourth death. For numbers across the state, for confirmed cases, this is always changing, but when this was written down, confirmed cases across the state was 1,352, in Mobile County 76. Reported deaths 34 across the state, 5 in Mobile County, but died from illness 21 across the state and 4 in Mobile County. And some people asked about the differences for that. On the ADPH dashboard, reported deaths and died from illness represent the number of individuals who have a positive lab result and are now deceased. To count a person who died from COVID-19, the medical record of the deceased person has to be reviewed by a physician and infectious disease and outbreak staff. Once the review is complete, if the death is attributed to COVID-19, the individual will also appear in the died from illness. Reported death totals are cumulative and will never decrease. This was a statement from Dr. Eichel today, who is our health officer for Mobile County. Actual cases of COVID-19 are less than 100, but we will be establishing a unified command in Mobile County, Alabama next week. It will include principals from the various jurisdictions and medical advisors from the community hospitals and organized medical associations. The format is fluid, and the Mobile County Health Department team is working closely with the City of Mobile, and I have personally had contact with some mayors. Because we are dealing with a highly infectious disease, the format will be virtual. We anticipate some form of stay-at-home guidance later today. So, from additional, now I'd like to introduce Kelly Warren. She's our Executive Director of Family Health, which is the primary care division of Mchd, and she's going to have some more information for us.
Thank you, Mark. Good afternoon, everyone. I'm going to bring you some information just about some of the demographics of the positive cases we have in Mobile County. As was mentioned the other day, now that we've reached a number greater than 50 patients, we're able to give you some more demographic data just to kind of give you characteristics around the positives in Mobile County. Currently, and this is as of data that we have that was entered into the Alabama Department of Public Health surveillance database last night by 7:00 p.m., we showed that we had, of the 69 confirmed COVID positive cases, 18 were hospitalized. The main age groups that seem to be affected right now and experiencing positivity is the 19 to 64 range, with 49 of the positives occurring within that age range. Right now, 30 of our cases are female, 38 are male, with 1 unknown. 37 of the cases are African American, 25 are white, 7 or other are unknown. Of the 18 that are hospitalized currently, 10 of those are between the ages of 19 and 64, and 8 or older, or 65 years or older. There is continuous investigation that is ongoing, so we may see some of those numbers change as more information is gathered and entered into the database. It remains the 2 primary zip codes that seem to be most greatly impacted right now are 36695 with 14 positives and 36608 with 12 positives. Shifting over to our businesses in the area, Dr. Eichel is sending a communication to all the local chambers of commerce, just calling on employers to keep their employees' safety and health in mind as they continue to report to work on a daily basis. We just, this letter would call for them to, again, avoid close contact with people who are sick, avoid touching your eyes, nose, and mouth with unwashed hands, wash your hands often with soap and water for at least 20 seconds. If you're not using soap and water, you need to use an alcohol-based hand sanitizer that's at least 60% alcohol. If you're sick, stay home. We cannot say this enough. If you cough or sneeze, please be sure to cover it with a tissue and then throw the tissue in the trash. And be sure to clean and disinfect frequently all touched objects and surfaces. We would go on to further recommend that all employees within their work environment, we would ask their employers to provide all employees who are having to work within a distance of one another that is less than 6 feet. Please provide them with new surgical type masks to wear each day. Additionally, we recommend that you be taking the temperatures of all your employees when they arrive at work, and if they are experiencing a fever and elevated temperature, it's encouraged that they get tested and not be working at that time. Again, this is all just taken out of an abundance of caution and to try to prevent spread as much as we possibly can. And now I'd like to turn the podium over to Amanda Arnold to give you some additional updates. Thank you.
Thank you, Kelly. Again, my name is Amanda Arnold, the director of the WIC program here in Mobile County. Just wanted to remind everybody this week we went to remote phone certification for all our upcoming appointments. So we're asking those who have a scheduled appointment to please call the clinic on the day and time that you're scheduled, and our staff will talk you through your appointment. To expedite the process, all your proofs that are required for WIC certification are now allowed to be emailed. That email is wicmchd@mchd.org. Again, that's wicmchd@mchd.org. You can expect this appointment to take around about an hour, so please be patient with us. If somebody doesn't answer the phone on your first call, keep trying, because we do have multiple clinics calling into a single space or a single clinic trying to get these taken care of. What's new for this week is your benefits are automatically going to be loaded on your issue date, and there's no need for you to call us or let us know. So if you do not pick up any special formula and you just have a basic food package, those benefits will be automatically loaded for the month on the day your issuance. So if your issuance day is the 6th, the morning of the 6th, all your food package benefits for that month will be loaded to your card. We're having a lot of calls with people wanting to know if their benefits are loaded, and the answer is yes, and you're taking up time in our queue for people who have appointments and are going to lose their benefits. So we need you to check your benefits. Those can be done by doing the following. If you keep your last receipt, your benefits will be on the last receipt. You can log on to wicconnect.com. That's wicconnect.com. Or you can call the eWIC customer service line at 1-855-279-0683, and we'll be doing a Facebook post with this information as well, so you can check that. If you happen to have pick up a formula or a nutritional drink that isn't allowed to be purchased in the store, cannot be purchased in the store, and you come monthly to pick up that, or anybody in your family does, you will still have your benefits will not be automatically issued, and you'll still have to come see us once a month to do that on your issue date. We're going to be doing that at the Teen Center located at 248 Cox Street. That's across from the Children's and Women's Hospital, and that'll be Monday through Friday from 8 to 4. So again, if you pick up monthly for anyone in your family, you will continue to do that, but you'll be doing it at the Teen Center on Cox Street. And your benefits for everybody in your family cannot be loaded. If anybody picks up a special formula monthly, their benefits won't automatically be loaded. Otherwise, on your pickup date, your benefits should be loaded. We'll get you the information on Facebook on how to check your benefits, and we'd appreciate you doing that. Thank y'all so much for working with us through this time. Stay safe and stay home.
Thank you for those updates. Just want to share this with you. This just came in from the State Health Department. Governor Kay Ivey on Friday will hold a joint press conference to provide further updates on Alabama's efforts to combat COVID-19. Joining the governor will be State Health Officer Dr. Scott Harris, Attorney General Steve Marshall, and Dexter Avenue Baptist Church Reverend Cromwell A. Handy. That will take place at 4 p.m. and I believe you can find it on the governor's Facebook page. Okay, and we did have some questions. The dashboard and the demographic numbers that we've mentioned, all that we've started posting that on our Facebook page. I love MCHD. So if you didn't have to write any of that down. That's the information we send out. We've been sending out to elected officials and certain medical providers, but we've now that we've got the demographics, we've decided to go ahead and share all this. And this wasn't any secret information. This was just gleaned from the ADPH website, CDC, Johns Hopkins University, their worldwide dashboard information. So all that information was publicly available. We would just condense it to help the officials and these providers. Okay, one other issue that's going to be taken on Monday, our vital records, which are birth certificates, death certificates, those items like that, they will be changing their days and hours of operation. Beginning Monday, they will be processing certificates from 7:30 a.m. to 4:30 p.m. on Mondays, Wednesdays, and Fridays. That's at our main facility, the Keeler Memorial Building at 251 North Bayou Street in downtown Mobile. There, because of the 6-foot social distancing, that we can only allow 3 clients in at one time. You can come in. Everyone who comes into our building has their temperature taken. So our security staff will make sure and queue the people up as one. If we have 3 at one time, as one comes out, another one will be allowed in. So, but if you don't want to do that, the option of downloading the form, the online form, and sending it in, you can go to our mchd.org website, and under the general, select services, click marriage birth certificates, and you can download the application. You fill that out and send it to ADPH, Center for Health Statistics, Box 5625, Montgomery, Alabama, 36103-5625, along with your payment of $15. But all that information will be available on the website. Okay, again, we have some questions from the media that we would like to answer. And if you have some particular, it's been kind of difficult to follow because we've had so many posts on Facebook. If you post a question there, if you would like something for our staff to answer, please send the email to me directly at mbryant, B-R-Y-A-N-T, at mchd.org. That way I can collect them and get them to our staff to help to try answer. It's just been too difficult to try to follow up on all because people are placing questions on different posts, and it's really hard to follow them. Okay. Somebody wanted to know, about our cooperation with other agencies and things. And I'm happy to announce that Dr. Laura Cepeda, our Chief Medical Officer, she was going to be here today, but actually she is going to be joining Mayor Sandy Stimpson of Mobile at his news conference today. So she's been attending their meetings to help make sure that our flow of communication goes great both ways between the City of Mobile and the Mobile County Health Department. Okay, here we go. Okay, if virus antibodies show up in these first tests during screenings, does that mean the person is immune from spreading the virus? Mobile has said that they do antibody tests first on first responders, and then if antibodies show up, then they do nasal swab to determine if they're contagious. They sound like that means they can have the antibodies and not be contagious. And it was answered by Dr. Randy Murphy, our epidemiologist. Yes, they can have antibodies and not be contagious, but antibodies are a sign of previous exposure to COVID. Please talk about the difficulty that being asymptomatic poses in trying to control the virus. What can be done, if anything, except, I guess, test everybody, but we don't have enough tests. Yes, asymptomatic infection or mild illness poses a challenge to community mitigation. All right. So people go to county health departments or your satellite clinics here in Mobile. Do they get it free or $50 or a certain price? No, we're not really offering generic free testing here at the health department. It's been available to clients or family health, if they, if they're symptomatic and they pass the protocols of the fever, the cough. But if our patients are insured, we've been sending the test to LabCorp for that purpose. If they're not insured or underinsured, we've been sending them to the state lab in Montgomery, which we know there's no extra charge for that. Now, for testing locations, you can go to the alabamapublichealth.gov website and click on their coronavirus, and their live real-time dashboard not only shows the counties and the active cases, there's also a tab showing testing sites. And I believe that as of this morning, there were six sites in Mobile County where you can get that. And if you don't have access, you can call the Alabama COVID-19 hotline at 888-264-2256 for testing sites and hours of operation. But they do not offer medical advice at that number. But it's open 24/7. Again, that's 888-264-2256. Okay. Well, I believe that was the last of the questions. Let me make sure. Yes. Again, if you have any questions for the media, please send them to me, and we'll try to get them answered. And then if you have questions from our public, please submit to me by email. Now, we will not be having the live broadcast on Saturday and Sunday. We'll pick back up on Monday afternoon at 2:30, but we will continue with the dashboard. I'm not sure about the demographics. I haven't found that out yet, but the dashboard will be going out on Saturday and Sunday mornings. Again, you can find them on our Facebook. It's I Love Mchd. So again, thank you for tuning in to us, and we will see you on Monday afternoon. Thank you.